Members, we move to questions to Minister of Health, and I call Linda Dillon. Minister.
I thank the member for her question. As you'll be aware, recently I was pleased to be able to approve additional regional funding for children with disability services, despite the financial circumstances facing my department. That funding allocation will enable up to £2 million to be spent over the course of the rest of this financial year, and then there will be £13 million a year in multi-year funding to support families who have children with disabilities. With regard to the allocation of the funding, each trust is currently working intensively with my department to agree what actions can be taken forward this financial year. I have been clear the plans must improve family support, short breaks, residential care and behavioural support for those families who have children with disabilities. And it is a tripartite approach, particularly with regard to respite and residential care. You need infrastructure, you need funding, but you also need a workforce who is suitably qualified and indeed committed to this challenging role. An immediate priority is to reinstate and expand overnight residential short breaks for children with disabilities, though I recognise this is only one component of the continuum of support these families need. Therefore, I have in addition asked the Trust to prioritise the continued development of short breaks, fostering or share the care services specifically for children with disabilities. These services can include support right through from befriending to overnight breaks. We're also working with the voluntary and community sector to see how we can expand and extend some of the services already available. One example will be to expand access to after-school clubs and youth clubs to provide families with some additional support. In the longer term, I want to work with parents of children with disabilities to my co-design. Is not about presenting a plan and asking what they think. It is getting us close to starting with a blank page and asking what they think at that point.
Right on the button of 2 minutes, Minister. So I call Linda Dillon.
Thank you, and thank the Minister. Apologies. Minister, I really welcome the answer that you've given. It does actually flesh out a wee bit more what we have been told around the funding. But can you give us assurances that accountability mechanisms have been put in place to ensure that this funding makes a real difference to these young people with additional needs and their families, and particularly given that this Thursday is Carers' Rights Day, and we know the pressure that is on carers, and we have a responsibility in health to those individuals as well. Can you give us some assurances around that?
I don't really approve of long questions or long answers, so far away, Minister.
I would like to give the member that assurance. I do believe the important thing is to recognise that co-design is starting with or as close to a blank page as possible, asking the service users, what is it you want, what are the obstacles in your way, and how can we overcome them. Now, we have got into a point where particularly residential care was being knocked out by short breaks because the two were incompatible in the same infrastructure. And what I want to be sure about is that we've understood what these obstacles are. So as we go forward, we remove the obstacles, but we also monitor the implementation.
Mr. Speaker, and I do thank you, Minister, because I think you have reacted to a situation that is pretty appalling across Northern Ireland. My question really is around the differentials in the offering between the different trust areas. I've been involved in a case where parents moved from the Southern Trust, where they had overnight stays, 5 minutes down the road, to the South Eastern Trust, where there was no provision. Their overnight stays in the Southern Trust was withdrawn, and when they moved back, of course, they're at the bottom of the waiting list, both for social care, for social work interventions, and for overnight stays. Can you assure me that you will be working on this issue of really what is a postcode lottery for respite services for across Northern Ireland?
Minister.
I can assure the member that is something that I am very much focused on. I see she's wearing a heart failure badge, as I have, from visiting people in the Long Gallery earlier today. We heard the two sisters on Radio Ulster this morning, one in the Southern Trust, one in the Northern Trust, and a very divergent set of experiences among the two. And it leads me to the conclusion that while it would be tempting to go from 5 geographic trusts to 1, I'm not sure that that wouldn't be any more than a divergence and a distraction. What I want is outcomes, and so I have made clear to the chairs and the chief execs of the 5 geographic trusts that I'm looking for, wherever possible, for regional services where they are collaborating and cooperating and not competing. So let's find out where best practice is happening with regard to any particular service and roll it out so that it is common practice right across the 5 trusts.
Randy Allen.
Mr. Speaker, and can I too join with colleagues in thanking the Minister for his proactive approach on this matter? Can the Minister give a commitment that when it comes to the allocation of funding, that the Trust and his department will work at pace to see tangible proposals and the delivery support on the ground?
Minister.
Thank the member. And it's intended the additional funding will assist with both increasing short break capacity and expanding both family, therapeutic and behavioural supports in the community right across all 5 geographic trusts. I think it's very important to recognise that overnight residential short breaks are only one part of that continuum of services which are needed for children with disabilities and for their parents and carers. And we must look at opportunities to expand support services which we can provide in the community, and those are under active consideration as we look towards a £13 million additional spend in the next financial year.
Question 2 is withdrawn. I call Diane Armstrong.
Thank you to the Minister for coming to the Chamber today. I'd like to ask the Minister for an update on elective...
Just the question first, just the number first.
Thank you. Elective care activity that's being delivered... Oh, the question. Thank you.
It's all going very well here. The South West Acute Hospital is a very important asset within the Northern Ireland Health Service estate, and I've had the pleasure to visit the hospital on a number of occasions, indeed with the member. Most recently, in recent months, I saw again how accessible and modern the facilities are. The hospital is commissioned for an average of 15.3 elective theatre sessions per week. That's across gynaecology, general surgery, paediatric surgery and dental. The number of patients actually treated will slightly vary each week, and that depends on the case mix. Whilst there had previously been a period of under-delivery, following a recent recruitment exercise, the Trust has successfully appointed 4 new consultants, and this has had a positive impact on theatre scheduling. I'm pleased to confirm the South West Acute is now delivering more elective activity than at any point before in its history. And while I'm very aware of some ongoing local concerns regarding the future of the hospital, I can assure all that its patients, staff and the wider community in the Fermanagh and West Roan area, I see the hospital continuing to play a very important and long-standing role moving forward. In particular, initiatives such as the Elective Overnight Stay Centre at the SWA are and will remain critical in helping to tackle our lengthy waits for elective surgery. Members will be aware, recently I encouraged people to view our hospitals as a network, and not every hospital will deliver every procedure, but there is a place for the SWA within that network.
Ms Armstrong.
Mr. Speaker, I thank the Minister for that very reassuring update, and I'm really pleased in particular that the hospital is delivering more elective activity than ever before. In light of some of the recent concern in the local area that the South West Acute Hospital is facing a downgrading following the publication of the network document, what reassurance can the Minister give that this simply isn't the case? Thank you.
Minister.
Thank the member. The hospital network document clearly states it's about the reconfiguration of acute hospitals, of which the South West Acute Hospital is and remains a part. The proposed designation of SWA as a general hospital refers to the tier at which it sits within the network, and it's not a reflection of it being downgraded from acute hospital status. In fact, the hospital network document doesn't contain any proposed reconfigurations. It simply sets a strategic context for future reconfiguration decisions.
Ms Cummins.
For his answers so far. Minister, in relation to the elective overnight stay centres, Daisy Hill is one of those and has been doing fantastic work to date. However, there's always room for more, and I would like to ask the Minister then for what consideration he and his department have given to potentially expand to include orthopaedic surgeries, because I know that is probably one of the biggest waiting lists that we do have, and many of us will have constituents who are on those waiting lists, so I'd like to hear a bit more.
The initial question is about the South West Acute, but I leave it in the hands of the Minister for his response.
Thank you so much, Mr. Speaker. I'm going to have to get back to the member, but what I would say to her that there are successes in terms of the transformation programme that we've undertaken since Ben Goa was first here in 2016, and the elective overnight stay centres are a part of that, as well as day procedure centres. I think a primary care multidisciplinary teams are the shining example. So within all that, yes, I would like to see Daisy Hill being enhanced as an elective care centre.
Deborah.
Minister for his answers. I did see in a recent media report that in the past 4 years 150 million has been paid from the public purse to private providers. So does that point to a capacity issue? I did have a meeting with the Trust recently in relation to the SWA, and they did say that they have a demand capacity gap which they're looking to try and sort out, and would rather that they get recurrent funding. So can the Minister point to the funding constraints that are there in relation to elective care?
Minister.
Well, I think the two issues are the quantum of the budget and the fact that it is a single-year budget, and I've said before I am optimistic that if we don't get to multi-year budgets for 2025-26, I see no reason why we can't get there for 2026-27. Not least because the Labour government will have embedded itself both in Downing Street and the Treasury. So I think those are the two issues which play into workforce, and workforce is always a challenge. There are so many moving parts in delivering healthcare, particularly at an acute hospital like the South West, that when one part falls down, it has a huge impact. In fact, it makes the whole thing grind to a halt. So workforce is a very key priority focus for me.
Neil McAllister.
For your answer so far, and I think it is positive news to hear that the 4 additional consultants have been placed at the SWA, but I wanted to ask whether the Minister has met with any of the representative bodies regarding the efficiency of the elective care, not just particular to the SWA, but to all of the elective care overnight and day procedure hubs across Northern Ireland.
Minister.
Well, I like to get out and about every week, and I've been to the SWA, I've been to most hospitals in Northern Ireland, I think, over the course of the number of months I've been in charge. So I do meet not just managers, but I meet people who are delivering services, including those overnight services. But in terms of a strategic review, that's carried out by officials.
Mr McNulty, right about the SWA, I assume?
No.
Well, then we'll move on to the next question. Daniel McCrossan.
Question 4, Minister.
The United Kingdom National Screening Committee recommend that bowel cancer screening is offered to individuals aged between 50 and 74. Currently here in Northern Ireland, anybody aged 60 to 74 who's registered with the GP is eligible for bowel cancer screening. Now, Action 7 of the Northern Ireland Cancer Strategy of 2022 to 32 has committed to reducing the sensitivity levels used in the fecal immunochemical test or FIT test and lowering the age range in the bowel screening programme in line with the UK National Screening Committee recommendation. A work to meet the commitments to lower the age range and further reduce the sensitivity level is ongoing, but it must be viewed within the context of the wider financial and capacity challenges within the supporting services. It's important to note that screening programmes are a pathway and not just a test, and as such, where a screening programme makes changes to its eligibility, it's important the associated infrastructure, including diagnostic capacity and any treatments that may be required, are aligned accordingly.
Mr McCrossan.
The Minister for the answer to that question, particularly referring to Action 7. And I appreciate your long-held commitment, Minister, and I know that you feel strongly about this, but surely every day of delay is putting further lives at risk. Why can we not just test people now that undoubtedly will save lives?
Well, it's a question of resource, it's a question of funding, it is a question of capacity, and there are many, many things on a daily basis. People come to me and say, why don't we do this? If you invest in this, you will save money there, you will deliver the better outcomes that you talk about delivering. But you need the infrastructure, you need the funding, and you need the workforce. And when those three do not align, you cannot make the sort of improvements that I would like to see.
Danny Donnelly.
Speaker, and thanks to the Minister for his answers so far. Could the Minister outline what engagement he has had with Bowel Cancer UK around the creation of a register for Lynch syndrome?
Minister.
Well, I haven't had particular engagement with them on the question of Lynch syndrome, which I understand is a genetic issue. But early discussions are underway with my officials to test the feasibility for the establishment of a Northern Ireland Lynch register, and those discussions are between my officials, with Queen's University in Belfast, Northern Ireland Cancer Registry and HSC staff.
Question 5 has been withdrawn. I call John Blair.
Number 6, Mr. Speaker.
Well, members will be aware that the Health and Social Care Trusts have responsibility for commissioning and delivering services for children and adults aligned to assess needs. Respite or short break care is defined as the provision of regular, occasional or emergency but time-limited breaks to those who are caring for others. Both statutory and independent sector care homes facilitate both planned and emergency short breaks for adults. In addition, short breaks are provided through the Shared Lives service. Currently, within adult services, there are a number of multi-use sites containing both short-term respite and residential or nursing beds. This model has been utilised in order to expand provision of respite services. My department is leading on the reform of adult social care under the auspices of the Social Care Collaborative Forum. The commissioning and contracting work stream is taking forward the review of the regional care homes contract and specification, which will include provision for respite places within the care home setting. The maximising capacity work stream is working to make most effective use of the available regional care home resource. Within children's social care services, short breaks can be provided through hospitals, children's homes and specialist foster care settings. My department is leading on the Children's Social Care Reform Programme established in response to Professor Ray Jones's review. The reform programme contains a specific work stream in relation to residential care of children, including the provision of short breaks. There is a specific task and finish group considering the introduction of multi-site children's homes, and by that I mean an arrangement where children are cared for across a number of buildings which are collectively registered as a single children's home. Both of these work streams will be concluding their specific pieces of work by March of 2025.
Mr. Speaker, thank the Minister for that answer. Can I ask further then if he could respond to parents confirming that their children are being sent out of Northern Ireland to access respite care when an answer to an AQW to my colleague Nita McAllister stated that this was not departmental policy, and in addition, given the conversation we had earlier about the £13 million available, how that might be used to address this issue across all trust areas?
Sir.
Well, I thank the member for his follow-up question. With his permission, I'm going to go away and just test the question of policy. Certainly, from my point of view, to send somebody out of the jurisdiction would have to be an act of absolute last resort, and I would hope that the availability from the 1st of April of a new £13 million fund for this area would go a very long way to making sure that that never happens again. And the fact that it does not happen would be my number one objective in terms of providing that sort of care.
Dr. Reagan.
Okay, thank you very much indeed. Thank the Minister for his answer so far. Could the Minister provide an update on the initiatives that his department has taken so far to improve the access to dental care in the Northern and Western Trusts, just to keep the Speaker happy?
Minister.
Dental care?
I think, Dr. Reagan, I'll call you for question 7. I'll call Cara Hunter to ask an excellent question first. You're ahead of yourself.
Please, Minister.
The community dental services within Health and Social Care Trusts provide dental care to patients who, for various reasons, are not suitable for treatment in the primary care setting. For young children, those with additional needs or particularly complex cases, it may be necessary for the treatment to be taken under general anaesthetic. To ensure that the most urgent cases are treated as quickly as possible, community dental services teams operate a strict triage and prioritisation process for general anaesthetic, which is based on clinical need. This means that for those patients considered to be acute or urgent, waiting times can be relatively short, but for those in the routine category, waiting times can be significantly longer. The majority of children receive all their dental care, including extractions under local anaesthetic in the general dental services. Extractions under general anaesthetic are indicated in children who are too young to tolerate the treatment under local anaesthetic, or who need multiple extractions, or who display disproportionate anxiety. General anaesthetic may also be required for those patients with additional needs who are otherwise unable to cope with invasive dental procedures. Some patients may require all or most of their dental care under general anaesthetic. This waiting list is separate from the paediatric extraction waiting list. Children with additional needs may be placed on either list depending on their individual needs. The Trust CDS teams have provided the following information for the current estimate average waiting times from the time of initial referral. Northern Health and Social Care Trust, 6 to 12 months for paediatric dental extraction lists, 8 months for patients with additional needs requiring comprehensive treatment. Western Trust, 1 to 2 months for paediatric dental extractions, and 1 to 2 months for patients with additional needs requiring comprehensive treatment.
Ms. Hunter.
Mr. Speaker, and I'd like to thank the Minister for his detailed answer. Minister, I'd just like to bring to your attention briefly a story of a family in my constituency based in Greysteel. It was a young girl called Maisie who has complex needs, and she was told she would have to wait a year to get this tooth that was causing her so much bother she couldn't eat out. Minister, can I ask you, recognising the pressures that are on this particular surgery, can I ask, has your department maybe explored looking at what we can do on a north-south basis, or could we create a scheme to enable these children who are struggling with the waiting lists for this surgery to find some way to get a resolve and to limit those waiting times?
Thank you. Minister.
Well, I thank the member, and I'm more than happy to engage with her in terms of the detail of this individual case. As a more general rule of thumb, the North-South reimbursement scheme, which was very successful, is no longer operating because there is not a budget for this. A bid was made within the last financial year for a budget to reintroduce that scheme. That was not successful. So that is the position we find ourselves in. Should that change, I'm more than open. I've said before in this House, sensible cooperation on a north-south basis is something that I would welcome.
Dr. Ekin.
Thank you very much indeed, Speaker. Minister, can the Minister provide an update on the initiatives that his department has taken so far this year to improve access to dental care in the Northern and Western Healthcare Trust, please? Thank you.
Mr.
No.
Guy.
Thank you, Mr. Speaker. Can I ask the Minister to update on discussions with the UK Government around support for dentists impacted by the recent budget announcements?
I'm not aware of any discussions that are ongoing between my department and the UK Government on the theme you mentioned.
Colin Crawford. Minister.
I thank the member. The Impact Age Well project, delivered by the Mid and East Antrim Age Well Partnership, is an integrated community development approach to improving the health and well-being of older people. The approach brings together those involved with the care and support of an older person, the GP, the community pharmacist, social care workers, and the practice manager within a locality hub. Impact Age Well are continually developing to meet the needs of local older people, and have recently commenced work in Inver Rehabilitation Ward, with officers being involved at the very start of the rehab admission to ensure that when the older person is ready for discharge, everything's in place for them to return home, such as food packs, meals on wheels, key safe referrals to occupational therapy, and so on. Impact Age Well have reported that since its inception, as well as improving outcomes for older people, they've saved approximately £6.1 million by avoiding unscheduled care costs to the health service in this area over the last 7 years. I see this as an example of best practice, which I'd like to see rolled out right across Northern Ireland to become common practice in how we deliver healthcare and support to an ageing population. I recently visited the Mid and East Antrim Age Well Partnership premises and confirmed a 2-year funding extension. This reaffirms the Department's commitment to supporting innovative, community-based solutions that address the health and well-being of ageing populations. The funding will enable Impact Age Well to continue its vital work, delivering integrated support and services for older individuals, particularly those facing challenges with isolation, long-term health conditions, or limited access to community resources.
Mr. Crawford.
Thank you, Mr. Speaker. Does the Minister agree that following his recent visit and discussions with staff, that the Impact Age Well project is a brilliant example of how spending money slightly different can deliver often far more significant benefits and savings in other parts of our health service?
Minister.
I agree with the point, and it's well made, I believe, by the member. He'll be aware that my objective is to deliver better outcomes for patients, for service users, for the population generally, as well as for those who deliver health care. And sometimes slight adjustments are all that is required. Sometimes a relatively small investment will have a disproportionately positive result. It is, of course, also important to monitor and measure outcomes, and the project is monitored quarterly against agreed targets by the Department of Health's Strategic Planning and Performance Group. The case studies provided to SPPG in monitoring reports also demonstrate outcomes at a service user level. The service will continue to be tested for value for money against other community care initiatives, such as acute care at home, which may cover some of the same areas.
Sean Mahone.
Delivery of the mental health strategy has been taking place within an extremely challenging financial context using existing limited resources to take forward actions. As a result of this, the strategy is being implemented through annual delivery plans which set year-on-year priorities and actions. And while the number of actions which can be taken forward are limited due to the funding position, good progress has been made in taking forward a number of areas, including implementation of the Community Perinatal Mental Health Service across the region. Teams are now in place in all trusts. Establishing the Regional Mental Health Service, including appointment of the head of the service and service user consultant, as well as preparatory work for formation of a regional collaborative board. Work is ongoing to embed a mental health outcomes framework within Encompass as it is rolled out. There's a development of a 3-year early intervention and prevention action plan, and completion and publication of an independent mental health workforce review, with work underway to begin planning implementation of key recommendations. Additional investment of £2 million in child and adolescent mental health services to enhance existing provision and alleviate pressures is underway. Also work to scope and develop a digital mental health service action plan. And finally, work to commission a review of the scope, scale and capacity of the community and voluntary sector to ensure they are fully integrated in the delivery of mental health services, building upon the previous report on the community and voluntary sector's collective voice. In the current year, our priorities are a continued focus on early intervention, developing a plan to maximise the role of the community and voluntary sector, the continued development of the regional mental health service, and stabilising and growing the workforce.
Ms Mulholland.
Thank you very much, Mr. Speaker, and thank you, Minister, for that. According to a senior police officer I've been speaking to recently, there's a spike in suicides amongst males in the Causeway Coast and Glens area, and I'm just wondering if this is something that your department is aware of in terms of that rurality approach, and when you look at something through the rural lens and the isolation that may cause in our young men, and I'm just wondering if there's anything specific.
Well, I thank the member. I am personally not aware of that spike that she refers to, but I would assure you that the department in all its actions is keen and eager and determined to look at rural impact, and that runs right across all the activities of health and social care.
David Honeyford. Minister.
The purpose of the plan is to highlight the wide range of policy and service development initiatives which are currently in progress, also to outline the actions and improvements that can be delivered over the next 3 years to improve health outcomes for women. At this stage, the focus is on mapping the work that's already underway across the health and social care system, including, for example, improving maternity, gynae and menopause services, cervical screening and breast cancer services, and planning for a mother and baby unit, as well as identifying areas where further action is needed. For example, improving public health awareness around women's health, providing more training and education for healthcare professionals on these issues, and promoting healthy lifestyles and tackling health inequalities. My department will be running a number of engagement events from January, listening to women and further informing the development of the action plan. The place and extent of delivery will be determined by our available capacity and resources, which remain under extreme pressure, and that is well documented. With regard to the budget required, clearly what is desirable exceeds what's available for the foreseeable future. However, there are many initiatives underway which have received investment or can be delivered at low cost or at no additional cost within current budgets. For example, in 2024, the introduction of primary HPV screening for cervical cancer and the delivery of menopause training to many healthcare professionals.
That concludes questions to the Minister. We now move to topical questions to the Minister, and I call Colin McGrath.
Mr. Speaker, a promise made should be a promise kept. Will you ensure that our healthcare workers get the 5.5% pay parity pay rise that they deserve?
Minister.
I thank the member for his question. There are a number of pay parity awards that are currently under consideration. I think the member will be aware that I met Agenda for Change unions and the British Medical Association last week to discuss the situation. I was also at a GP conference in the centre of Belfast on Saturday discussing the same issues. It is a matter of regret for me that there has been a leak which has put part of what I'm calling the plan into the public domain. I think that has led to a degree of misunderstanding within health and social care and the broader public. So the situation is that the Department of Finance was well aware ahead of October monitoring that I needed £130 million to balance the budget and £320 million to deliver pay parity awards. In other words, 450 in total. I got 350, so there is a gap of 100 million. The Department of Finance, and I think the Executive generally, are extremely keen that we all balance the books, because if the Executive does not, the Treasury may want to recoup a £559 million loan, which they are otherwise prepared to write off. I don't want to be the man responsible for that £559 million coming out of next year's Executive budget. At the same time, I want to deliver the pay parity. It is in the public domain that I have said that the £220 million from October monitoring that's left to me, I can use to deliver those pay parities for 8 of the 12 months. I am now working at pace with Executive colleagues to try and close the gap, which exists from the 1st of April last to the 31st of July last. From last Monday's Executive meeting to today, I think there is now a real collective will to do that, and not just for healthcare, but for all public sector pay.
Mr. McGrath.
Minister, yes, a promise made that was then broken would be replaced with another promise that the money would be forthcoming next year, which I think is an awful lot to ask our healthcare workers to accept. Will the Minister commit to stop the Executive politicking of blaming each other on why they don't have the money, and just ensure that our healthcare staff who work exceptionally hard get the same money as everybody else in these islands and that they're entitled to?
Minister.
If I heard him correctly, he seems to suggest that part of this year's pay will be delivered in the next financial year. What? Oh, in January? Yes. The point to me is that it is delivered within the financial year. Now, if it happens to slip, that is a matter of regret, but it's not as big a regret as if I can't deliver it at all, and I am determined to deliver it, even if it slips into 2025, the calendar year thereof.
All right, Harvey.
Mr. Speaker. Minister, could you outline the actions your department has taken to address inequalities in women's cardiovascular health in light of the recent publication of the Bias in Biology report by the British Heart Foundation? Thank you.
Well, I thank the member for his question. I suppose, like me, he may have been in the long gallery for the heart failure meeting earlier today. Mr. Speaker, I don't know if it's a declaration of interest or not, but that is the very condition that I was diagnosed with in 2016. So I declare I have 2 stents, a pacemaker, and a defibrillator. Kind of greedy of me, I suspect you might think. But last week I met with the British Heart Foundation prior to the launch of that Bias and Biology report regarding the heart attack gender gap. I welcome the report. It highlights issues of unawareness, underdiagnosis, and undertreatment of cardiovascular disease among women, and it provides a number of helpful policy recommendations which my department will now consider. I further recognise the need for improved education and information on a wide range of women's health issues and risk factors. I want to support women and healthcare professionals in the identification, the management and the treatment of conditions, including cardiovascular disease, one of the leading causes of death among women. And this will form part of the Women's Health Action Plan, which my department is developing.
Mr. Harvey.
And thank you, Minister. Could the Minister maybe outline the budget your department intends to allocate to Women's Health Action Plan? Thank you.
Minister.
I thank the member for his question. I don't have a specific answer for him, but I want to make this point because some people think I'm not in favour of a women's health strategy. I am, in principle. What I think is not the right thing to do is to deliver a strategy that you can't afford to deliver upon. And the member may be aware that I have campaigned since I came here many years ago on mental health. So when Robin Swan became Health Minister, I was delighted he appointed a mental health champion and brought forward a 10-year mental health strategy. However, if you look at this year's action points, the mental health champion, Professor O'Neill, will tell you the department only has about 1/8 of the budget required. So you're raising expectations only to disappoint. And that is why I want to go for a costed action plan as a first step towards delivering the strategy. The exact quantum is still under discussion as we firm up the elements that go into the plan itself.
Minister, a recent article in the Fermanagh Herald highlighted that over 150 million has been spent on private consultants over the last 4 years. Whilst I acknowledge the contribution that private sector can play in reducing waiting lists, this level of spend on private consultants is unsustainable in the longer term. So what will you do, Minister, to ensure that we have the capacity within the public health system to deliver services without the need to rely upon using the private sector?
I thank the member for the question. I think it's a very important point, and the member may well be aware, I'm sure he is aware from his former role, that the department took a look at agency nurses and the extreme, well, the cost. It was a very significant cost that these nurses were incurring, and a decision was made to stop, and that was successful. And I have to say, I'm being told that there was a bit of scepticism when the proposal was first made, but it was actually delivered. The same focus is now going to be brought to bear onto this issue. I would add further that, while I understand why we sometimes go into the independent sector, particularly to tackle waiting lists, it makes me very, very nervous, because if you go to somewhere like the Kingsbridge up the Lisburn Road and you're putting in 1 day a week, say, as a surgeon or a consultant, you're in a very fine, enjoyable working environment. And so the private sector, to a certain extent, can become something of a Trojan horse, in that you could lose some of your best workers to that private sector. They start at 1 day a week, maybe they decide, well, this is such a nice place to work, I'll do 2 days a week.
Minister, and I do share that concern overall and think it's important. Minister, it's very clear that more needs to be done to attract the required consultants to come and work here right across the north and indeed in the Western Trust area. What more can you do or are you doing to attract the required consultants to work in the public sector?
Minister.
Well, I think there are a couple of points on that. For example, some people think that consultants work for specific hospitals such as Craigavon or Daisy Hill. Contracts should be with a trust, and they should be told that they are expected to travel as demand dictates. We've had some successful forays abroad and to attract international colleagues, and they have helped to close the gaps. It's not just about pay, to my mind. It is about making the job attractive, and I know the member's colleague, the Minister for the Economy, has got a focus on a definition of what a good job is, and I've rehearsed my views in this chamber before. So I think there's a whole mix that needs to be put together to try and make consultants and everybody working in health and social care understand that HSC in Northern Ireland is a good place to work, that it offers fair rewards, and it offers opportunities to develop in a personal and professional capacity.
Liz Kimmins.
On the topic of women's health inequalities, you'll be aware of the report that is in the media today around obstetrics and gynecology, and we are seen as having the worst outcome across these islands. And I am aware that some of the figures are quite stark in relation to timeframes when women should be seen within 2 weeks, and some are having to wait up to 16 weeks in my own trust area, in the Southern Trust. Can the Minister therefore outline what work his department is doing to address this critical issue, which is probably the only area of healthcare that is specific to women only?
I thank the member for her question. I will certainly take that away, because I think what we're doing as a general point is looking at the productivity and the efficiency of the health service, particularly with regard to elective or scheduled procedures, because there is more to be done to deliver in a more efficient and effective and timely manner. And the area you identify could well be top of that list.
Ms. Cummins.
Answer. And I think, Minister, within that, one of the most concerning issues in gynaecology is around red flag referrals. So I'd ask the Minister if he could give an update on any work in relation to that, because I think for many women out there, we've had the cervical smear review in the Southern Trust. That will be the most worrying aspect of it. So if you can provide any information in relation to that, I'd be grateful.
Minister.
I think the member is aware that where money is available, it is being targeted towards red flag referrals. But I met with the member and a group of women from her constituency, and some of the narrative was truly shocking, not least the weight. The weight wasn't being measured for some people in months, it was being measured in years, and I'm not saying 1 or 2 or 3 years. I'm talking, I think in one case, I think I'm right in recollecting 7 years of a wait. Is that acceptable? No, it's not.
Minister, I met with the Ladies with Letters campaign last week, a really determined and articulate group of women who have found themselves caught in the cervical smear scandal within the Southern Trust. I understand you're moving into the second part of the review into that piece of work. Can you give us an update on that, please?
Minister. Member for her question. Yes, I think that the review is due to be completed shortly. A report will set out the factual findings of that review. A further factual report will set out the facts in respect of the invasive cervical cancer audits. These 2 reports will be produced by the Public Health Agency and the Southern Trust, and then a detailed analysis will follow, and that will be supported by appropriate independent experts. It's important for me to say that as we await the outcomes and the analysis, that they will determine next steps. As Health Minister, I remain committed to finding the most appropriate method to understand what happened and to learn lessons, and to ensure our screening programmes deliver on behalf of our population. Now, the Belfast Trust is now the provider of the regional laboratory service for cervical screening programmes. This service model is necessary to ensure the performance standards and the minimum requirements of screeners and reporting staff are maintained.
Mrs. Guy.
Thank you for the answer, Minister. I know you've dealt with the ladies, and I'm sure they appreciate that update. But I'd like to ask the Minister if he will establish a statutory inquiry into this matter so that the ladies get the accountability and the transparency that they deserve.
Minister.
I thank the member. At this stage, my priority is waiting to be given the cervical cytology review, that report, the 2 reports that I mentioned in my previous answer, and to examine them. In terms of a statutory inquiry, a public inquiry, it asks a number of questions. It asks what happened, it asks why did it happen, and included in why is who was responsible. And then it asks what can be done either to ensure it never happens again or to minimise the risk of it ever happening again. I want answers to all those questions. I want the ladies with letters to be satisfied that they have got honest, appropriate answers to all those questions. If it can be achieved by another route that is not a public inquiry, but a route that gets us to where we need to be in a more efficient and a quicker manner, that's where I will go. And I have said to the ladies with letters, I just asked them to consider the amount of pressure they're going to put on themselves as participants in a public inquiry, because public inquiries are not easy, and they're not easy for people like the ladies with letters. So I'm not ruling it out. I'm saying I want to get the answers that a public inquiry will provide, and if it turns out it is the only way to get there, then I will certainly look at it very positively.
Okay, that brings no more time for further questions. We move to questions to Minister for Infrastructure, and I call Dr. Aiken.
Please.
Minister.
My officials continue to process application, and as the Minister for the responsibility for this planning decision, I will fully